the microbiology of HIV and AIDS. So I feel like in healthcare and society we talk about HIV and AIDS a lot, but I feel like no one really knows the microbiology behind it. And so I thought that would be something that was really interesting to explore for this class. So, HIV stands for Human Immunodeficiency Virus. It is a virus that infects and destroys human immune cells, causing progressive failure of the immune system. So, HIV was first described in 1981 after an unknown illness began to sicken young homosexual men in California and New York. When this initially presented, there was nothing known about this virus. It wasn't known whether it was contagious or not, or even how it was spread. So it caused a lot of fear among these communities, especially the communities that were affected, which were mainly young homosexual men, um, individuals requiring blood transfusions, such as hemophiliacs, and individuals who used intravenous drugs. The main outbreaks were mainly seen in San Diego, San Francisco, and LA, as well as New York City. Um, the disease was not identified officially until 1986, so there was definitely a long delay in identifying and addressing the virus, and there continued to be a delay for a very long time in developing appropriate disease management, antiretroviral drugs, as well as acquiring proper funding for the research needed for this disease. So there was a lot of stigma that definitely played into the delays in addressing this epidemic. Um, so HIV has no cure, but it can be effectively managed with a strict regimen of antiretroviral drugs. HIV used to be a death sentence. It used to have a very high mortality rate. Now, many individuals that are on effective antiretroviral regimens are asymptomatic and have undetectable viral loads, which means that they cannot transmit the virus. So we're seeing a significantly increased rate of increased lifespans with this virus, as well as improved quality of life. So, unfortunately, we still do see the progression of HIV into AIDS, which is also called acquired immune deficiency syndrome. So this is the most advanced stage of the HIV infection, in which a person develops infections and cancers that were only seen in severely immunosuppressed individuals. This is less common than it was due to effective antiretroviral drugs, but we still do see it in the clinical arena. So there are many ways that HIV can be transmitted. The most common way is via a horizontal transmission, which is the more common way. So the most common route of transmission is through sexual activity. So it can be transmitted via semen through anal or vaginal sex, since there is the involvement of active virus particles with mucous membranes. That's a way for the virus to get into the body. It can also be transmitted through blood exposure. This can occur due to the sharing of needles or syringes, often through IV drug use, and can also be transmitted through blood transfusions. This used to be very common before there was universal screening of blood for bloodborne pathogens. Now that this widespread screening is performed, it's very, very rare um, to be exposed to HIV through a blood transfusion. Vertical transmission also occurs, but is less common. It can be transmitted from mother to fetus during pregnancy or childbirth. This is also very rare because now, if we know a mother is HIV positive, she will be put on intravenous acyclovir, which is an antiviral drug. I've seen them administer that during childbirth, and it is almost 100% effective in preventing the transmission of HIV to the fetus. It can also be transmitted from the mother to infant during breastfeeding. So I just wanted to do a quick overview of the immune system, just because it's pretty integral to understanding how HIV works in the body. So HIV mainly affects helper T cells, also known as CD4 cells, and these are integral to the functioning of the immune system. T cells pretty much act as directors of the immune system. They communicate with other immune cells through cell-to-cell binding and cytokine release. So one of the main things they do is stimulate B cells to become memory B cells, which then go on to produce specific antibodies against specific pathogens. They also activate natural killer cells and killer T cells to destroy virally infected cells, cancerous cells, and other pathogens. They also direct macrophages to engulf bacteria, viruses, and other parasites. So you can see that T cells have a very wide, important role, and since HIV affects primarily T cells, it can have a catastrophic effect on the functioning of the immune system. So the life cycle of the HIV virus is pretty complex. So the HIV virus attaches to cells with CD4 surface receptors, which are primarily helper T cells, but it can also be macrophages. Once the virus attaches to the outside of the host cell, it can inject viral RNA and replication enzymes into the cell. Once these materials are inside the cell, the virus uses reverse transcriptase to produce double-stranded viral RNA from single-stranded viral RNA. Once this DNA is produced, the enzyme integrase splices viral DNA into the host cell DNA. So the virus now makes its DNA part of the host cell DNA and can use the resources and the environment of the host cell DNA to further its own reproduction. So this new altered DNA now includes instructions for the production of thousands of copies of the HIV virus. So in this process, thousands of viral particles are produced. These viral particles are ejected from the cell in a vesicle in a process called budding. So when this cell buds or kind of breaks off, proteases are activated in these new vesicles, and they cut these long strands of infectious material into virions, which essentially converts them to their infectious form. So this vesicle forms its own independent HIV virus that can attack other CD4 cells. Stage 1 is the stage that describes the acute HIV infection. So in the days and weeks after initial exposure to HIV, the virus is replicating rapidly inside the body. So as a result, the CD4 cells drop due to the rapid destruction by the high number of HIV viruses in the bloodstream. Since there isn't an immune response yet, the HIV virus can kind of replicate uncontrollably. When the immune system does recognize this viral onslaught, it begins producing antibodies. And once those antibodies begin to be produced, this is called seroconversion, in which antibodies against HIV are present in the bloodstream. So this relates pretty closely to the clinical presentation of acute HIV. An average of 21 days after the initial exposure to HIV, individuals will experience flu-like symptoms. So this can be fever, headache, sore throat, body aches, and swollen lymph nodes. This is due to the rapid production of antibodies against the virus and other immune responses in response to this large amount of circulating virus. So people might just think that they have a viral illness or they have influenza, and although they might present to their doctor or local emergency department, there is no indication that it's anything else, so it's unlikely that they would be diagnosed at this point. They would probably just be diagnosed with a viral infection. So individuals in this part of the stage of HIV have very high levels of the HIV virus in their blood. They don't have the antibodies needed to trigger the immune response against the HIV virus, so they are very infectious, they have a high viral load, and they can transmit it quite readily. So individuals that are tested during this stage may test negative for HIV antibodies because their body may not have seroconverted yet, but they will test positive in tests detecting viral load. So unfortunately, viral load tests are not first line. It's usually the test for HIV antibodies. So this is not a stage where HIV will usually be detected. Stage 2 is the chronic latent phase of HIV. So, in this phase, viral replication slows due to the presence of a significant amount of antibodies against HIV. So, now that the body has recognized the HIV as an invader and has created antibodies, replication is suppressed somewhat. So, the virus resides in surviving T cells that convert back to resting memory cells. Activated T cells directly involved in the immune response are extremely susceptible to destruction by the HIV virus. So, for those T cells that manage to survive being infected with an HIV virus and revert back to memory T cells, they can kind of act as a host or a reservoir for the HIV virus during this latent phase. The destruction of CD4 cells continues as the HIV virus uses them to replicate. So T cells do continue to be destroyed, not nearly as a rapid rate as in stage 1, but still enough to progressively cause more damage to the immune system. So in stage 2, the clinical presentation is definitely not nearly as severe as seen in the first stage. So this stage can last up to 10 years following the initial infection. Individuals may be asymptomatic, or they might have only minor symptoms, which are nonspecific and often do not raise an alarm. It's likely that they will just kind of chalk these up to stress or a virus or some other kind of illness, just because they are so nonspecific and don't really tend to have a significant effect on their daily life. So these might be intermittent fatigue, weight loss, diarrhea, which are things that can easily be attributed to other conditions or disorders. So individuals on effective antiviral regimens often do not see a progression in the disease past this stage. So because they are on these antiviral regimens, the replication of the HIV virus is severely limited or completely suppressed in individuals with an undetectable viral load. So this protects immune cells from damage and destruction, allowing them to maintain the protection against microbial invaders that otherwise would be destroyed if they had HIV and were unmedicated. So stage 3 of HIV is called the advanced HIV infection, or AIDS, the acquired immunodeficiency syndrome. It's now called advanced HIV infection. It was previously called AIDS, but I still do hear it referred to as AIDS pretty often. So the microbiology of stage 3 AIDS shows a severe destruction of the immune system. There has been a mass destruction of T cells and macrophages by HIV viruses. The sufficient and well-functioning immune cells that are needed to fight off pathogenic microbes are no longer present. So the microbes that would usually protect us from bacteria that we experience every day, they're just not there, so the body is much more susceptible to pathogenic microbes. So pathogens and cancerous cells are pretty much free to invade tissues and cause extensive damage with little resistance from the body's immune system. So the clinical presentation of advanced HIV infection is pretty evident. So individuals meet the criteria for AIDS when they have a CD4 count below 200 or the presence of an opportunistic infection or cancer. So individuals that are healthy generally have a CD4 count of around 1,000. And opportunistic infections are illnesses that typically only affect severely immunocompromised individuals. So these are infections that you usually only see in people who are on immunosuppressive regimens from cancer, or they have blood cancer or have been on steroids for a very long time that cause immunosuppression, or they have some other kind of disorder that causes severe immunosuppression. And unfortunately, individuals with advanced HIV infections typically only live 2 to 3 years after their diagnoses. So I just kind of wanted to highlight pneumocystis pneumonia, or also called PCP pneumonia, which is caused by the Pneumocystis jirovecii fungi. So P. jirovecii exists in the lungs of healthy individuals without causing disease. Our immune systems usually keep it in its immature form, so it doesn't really have the opportunity to cause damage to surrounding tissues. But in individuals that are severely immunosuppressed, P. gyarevitchi matures into its cystic form. So this activates an inflammatory response in the alveoli and causes a significant amount of damage to the lung tissues. And because of this, individuals experience severe hypoxia and eventually respiratory failure. We see a lot of damage to the alveoli, which, as we know, are integral to proper oxygenation, with taking in oxygen and getting rid of CO2. And if you can't do either of those effectively, you're going to experience progressive respiratory failure. So as you can see in this chest x-ray here on the left, you can kind of see these small holes or circles. Those are cystic growths of the P. gyarevitchi. You can see down here on the right, this is a CAT scan with a CAT scan dye, and those black holes and circles are actually the cysts of the P. gyarevitchi, and you can see how much damage it's done to the lung tissue. So as you can see, these infections we don't see very much just because we don't really see them in people with healthy immune systems. I've taken care of patients with this before, and I've seen them decline very, very quickly just due to the damage that opportunistic infections do to the body. So there are some other common opportunistic infections that we see associated with end-stage HIV. So that includes Kaposi sarcoma, which is a skin malignancy that is commonly seen in individuals that are severely immunosuppressed. There's toxoplasmosis, oral candidiasis, also known as oral thrush, oral and genital herpes. Most individuals might not really show symptoms of this, but in individuals who do not have the ability to suppress these disorders, they can have pretty severe outbreaks of oral and genital sores. Other conditions are tuberculosis and salmonella. So I just kind of wanted to go over my final thoughts of what I learned in this presentation. So I did not realize how complex the study of HIV was. It's a very complex virus, and it has evolved over decades and decades, and this has given it very unique adaptations. So I think it's important in the field of microbiology because I think there is a vaccine in progress currently, and that vaccine is going to be the result of microbiologists and virologists working together. So I'm excited to see where the study of microbiology and HIV takes us. And I'm also excited to have this newfound knowledge about HIV because most of this I didn't know, and I'm excited to apply it to my future studies in healthcare.